Just 10 years ago, FDA released a safety announcement warning that injection of corticosteroid into the epidural space of the spine may result in rare but serious adverse events. In 2009, FDA began evaluating serious neurological complications associated with epidural steroid injection. Between 1997 and 2014, a total of 90 serious and fatal neurological events were reported to FAERS, including cases of paraplegia, quadriplegia, spinal cord infarction, and a stroke. Cerebral injections were associated more likely than in the lumbar region, especially spinal cord. Some